All right, let's get right into it. In the post-pandemic world, there's been a really troubling rise in neuropsychiatric conditions. Today, we're going to dig into two key data sets that might just offer some clues as to what's going on. So here's how we're going to break this down. We'll start by framing the central question we're trying to answer. Then we're going to follow the evidence and look at two very distinct data signals. After that, we'll see how these signals stack up against each other and what happens when you place them in the broader context of everything that's been going on. And finally, we'll be left with some pretty big unanswered questions. All right, let's kick things off with the mystery at the heart of all this. So what is going on? What's really behind this spike? That is the billion-dollar question for clinicians and researchers right now. To start tackling it, we're going to explore two major streams of evidence that point toward potential answers. Okay, our first signal comes from a place you're probably familiar with, the Vaccine Adverse Event Reporting System, or VAERS. This is that national early warning system, co-managed by the CDC and FDA, designed to flag potential safety issues with vaccines in the U.S. Now, to really get what VAERS is telling us, you have to understand this one key tool, the Proportional Reporting Ratio, or PRR. Honestly, the easiest way to think of it is like a tripwire. When a specific side effect gets reported way more often for one vaccine compared to all the others, that PRR number shoots up. The official threshold, the point where the CDC and FDA say, whoa, we need to look closer at this, is a PRR of 2 or more. And wow, here is what the data shows. A recent study that dug into VAERS data through late 2024 found some absolutely eye-popping proportional reporting ratios for neuropsychiatric events after the COVID-19 shots, especially when you put them up against the annual flu vaccine. And just to put a fine point on it, look at that number, a PRR of 118 for cognitive impairment. That's not just a little over the safety threshold of 2, it is nearly 60 times higher. This is exactly what researchers are talking about when they say they found an alarming safety signal. Okay, so that's signal number 1. Now let's completely switch gears and look at our second signal. This one has nothing to do with a vaccine reporting system. Instead, it comes directly from patients who've actually had and recovered from the COVID-19 infection itself. You've definitely heard of this. It's officially called post-acute COVID-19 syndrome, or PACS, but pretty much everyone just calls it long COVID. It's this really complex, frustrating condition with a whole host of symptoms that just linger. And it has been the subject of a ton of research. So a huge meta-analysis back in 2021 found a really high prevalence of these lingering symptoms in patients even up to 6 months after their infection. And look at what's topping the charts. Sleep disturbance, fatigue, and objective cognitive impairment. Starting to sound familiar, isn't it? I mean, think about that. Over a quarter of patients in that massive review were still dealing with sleep disturbances. The similarity in the types of symptoms being reported across these two completely different datasets is pretty striking. Which, of course, brings us to the big question, how do these two signals really compare? All right, let's do just that. Let's put these two streams of data right next to each other, because this is the puzzle that researchers are trying to piece together. So on one hand, you have these incredibly strong statistical safety signals from the VAERS database, those huge PRR numbers. And on the other hand, you have the actual documented prevalence of remarkably similar symptoms in people who've recovered from the virus itself. Two different sources, two different ways of measuring, but a deeply troubling overlap in the outcomes. So what do you do with that? As a clinician or a researcher, how do you even begin to interpret this? It's a huge analytical challenge. It forces us to confront the core question of causality, and it leads us right into the broader and often heated context surrounding all this data. Yeah, you really can't look at this data in a bubble. You have to understand the world it exists in, a world that's been shaped by some major legal and political developments. I mean, just look at this timeline. The years 2025 and 2026 were turbulent, to say the least. You had Robert F. Kennedy Jr. becoming HHS secretary, $500 million in mRNA research contracts getting canceled, and then the CDC changing its recommendations for kids' mRNA shots. That last move kicked off a massive fight, with 15 states actually suing the federal government to put the old recommendations back in place. And while all that was happening on the policy front, some huge legal cases were coming to a head. One of the biggest involved the healthcare giant Kaiser Permanente, which was facing some really serious allegations of widespread systemic fraud. And it ended with a massive settlement, over $500 million. Now, it's really important to be clear here. This specific case was about something called upcoding. Basically, they were accused of tacking on fake diagnoses to patient records just to get bigger payments from Medicare. While that's a whole separate issue from the vaccine safety debate, it contributes to this broader crisis of trust in our healthcare institutions. And that erosion of trust absolutely affects how people interpret the kind of data we've been looking at today. Okay, so after looking at these two powerful data signals and wading through the really charged context around them, where does that leave us? What's the bottom line for public health officials and medical researchers? Well, we're basically left with this dual reality. On one side, you have these undeniable statistical safety signals popping up in the vaccine reporting systems, and on the other, you have a huge number of people experiencing nearly identical symptoms after getting the virus itself. Both are real, both are statistically significant, and both demand a lot more rigorous investigation to figure out what's really going on. So is it the virus, the vaccine, or some combination of both? That is the critical, unresolved question. And teasing apart these overlapping signals is one of the most difficult challenges facing medical researchers today. Answering this isn't just an academic exercise. It's absolutely essential for understanding patient experiences and for charting the future of public health.